apple, you guys know that, right? Number 2. What is your favorite color? What is, Emily, probably can't answer. What is the CO2? Which is my respiratory. And then you ask, is it acid? Base. Number 3. What is the bicarbonate? Is it acid? Is it base? Number 4. What is the level of my voice? Compensation. Is it full? Is it partial? Or is it no clue? No, is it non-compensated? This is so easy. Hang on, you guys. Just bear with me. I promise this will all make sense in case you haven't already done it this way. Okay. So let's do, I'm just going to dive in. Did you guys get this? Because I'm going to erase it. I'm going to put a PowerPoint up in just a second once we get going. I'm going to put it on these 2 screens because I need this screen. Can you guys see the 2 screens? Can I put it there? Have I put it there? Okay. Where is it? That's not what I want. That's not what I want. Aha. This is what I want. No, I wanted that. That's what I thought. Oh my gosh, I've lost my mind. Just ignore me. I needed 3. That's what I was getting confused on. How many of you guys have done this before? So what do we do first? pH, PCO2, bicarbonate, and this would be acid, this is normal, and this is base. So refer to this. I can write those values out here as well. but I wanted you to not have you stand right there. Because then you'll be like on a test going, where'd the numbers go? They were written next to it last time I did this. Okay, and then you're going, the part that probably people haven't done a whole lot of is compensation, full, partial, or non-compensation. Actually, they call it uncompensated. So when you have full compensation, your pH has gone back to normal. And when I have non-compensation, either my CO2 or bicarb, either one of those one is going to be normal, one is going to be abnormal. So one is okay, the other not. So what does this mean? So what this means is, if I am fully compensated, remember how I told you if we get the body close enough, it'll fix itself. So when I have full compensation, that means my body has gotten things back into the pH that it wants. I'm not worried about the carbon dioxide and the bicarb just yet because they'll catch up. Again, remember I took my body just to that point and I'm letting the rest of it physiologically catch up. So if it's considered full compensation, all that tells me is that my pH has gone back to normal. My other values are probably going to be a little off still. Because otherwise I would have a problem. That's an acid-base problem. If I have partial compensation, all three of my values are abnormal because my pH has not been compensated yet. It has not corrected. And my other two systems, my respiratory system and my renal system, haven't continued to do, or haven't caught up yet to do their job. So when all three values are jacked up, it's partial compensation. If I have my pH wherever it is, but my bicarb, let's say my bicarb is normal and my CO2 is abnormal, then that tells me that I have not begun to compensate at all. And again, remember my respiratory is going to correct the first, because it's the fastest, because I can blow off CO2 really quickly. My kidneys take a few minutes to start filtering out hydrogen ions and keeping the bicarb going. So my kidneys are going to take a little bit longer, but they're more long-term adjustment. They're just longer. And then, of course, my buffer system that's in my blood is constantly just going through and taking and giving, whatever, to keep these little bitty adjustments. So that's all this means when I'm talking about full compensation. That means I have gotten my body back to normal. So I might have, like, this is 20 to 1. I might have 2 hydrogen ions, but I have 40 bicarbs. My body's trying to get balanced back out. But if I have full compensation, meaning my body has dealt with the problem, we just haven't got all caught up yet, my pH is normal. My other words are still going to be off because 2 to 40 is not the right balance, but they are in balance. Make sense? Because it's a 1 to 20. So as long as I keep it 40 to 2, 80 to 3, whatever. No, actually it would be 60. You guys get my point. So all we care about when it says full compensation, that means that my pH has gotten back to normal. My other two values are going to be jacked up, but they're balanced. And now it's up to my kidneys and my respiratory to get rid of the excess and keep things in balance. Partial compensation, my body's trying. We're just not there yet. All three of the values are messed up because my body's trying. We just haven't gotten things back up yet. Non-compensation, one of them's okay, but the other one's not quite getting caught up yet. So, let's do a little practice. My pH is 7.26. My my PCO2 is going to be 32, and my bicarb is going to be 18. Now take a minute, you try, and then I'm going to give you the answers. Okay, my pH is 7.26. We're starting right here. Is that acid, normal, or base?
Acid.
My bicarb, no, what's next? PCO2. PCO2 is 32. Is that acid, normal, or base?
Base. Base.
30.
Why? Between?
It's low.
I switch it so that all of my acid values are on one side and my base values are on the other.
But it's between 32.
So if
It's
it's
the
32,
city.
it's low.
Isn't it low? Isn't it base?
Oh, yeah, it is low. It's better.
Oh, what?
Yeah, okay.
I just wanted to see if y'all pay attention. Okay, and what was the last one? My bicarb. My bicarb is 18.
18 is acid.
Metabolic.
So you go off of your pH, so you know I'm in acidosis. Is my problem metabolic or is it respiratory? You have to look at which one is the most jacked up. Which one is the farthest away from normal? Metabolic. This is metabolic acidosis. Huh?
Partially compensated,
Am I
right?
full, partial, or un?
Partial.
I don't have anything in normal, so it is partial. And again, when you're like this, you go, okay, which one's the biggest jacked up one? Because that tells you where the problem is. That's the one that's going to have to work so hard to get caught up. My PCO2 is only off by 2, 3, but my bicarb is 18. It's off by 4.
So when none of them are in range, it goes directly to partial.
All 3 are abnormal. Because my body has nothing is in its correct value at all. But the body is trying, it has to. Your body's not just going to go, and then metabolic acidosis again. Okay. Your body's not going to do that. Your body is always trying to compensate.
I'm too confused. So I understand the whole PCO.
I'll flip it for you.
Well, no, I understand that part. I know that it's 35 and 45. But if it's, the PCO2 is 32, wouldn't that be
It's still
acidic?
acidic, you're right, I mean, if it's 32, right?
Because with CO2 is opposite. It's when you're doing with, right.
What was my number?
When you
32.
Yeah. It's low. No, this is a low number.
Yes.
Remember, CO2 is acid. So if my acid is low, it's basic.
So it's opposite.
Yes.
Basically, right?
Does that make it easier for you guys?
ROME, right? Yeah.
No,
Yeah, no, you're right.
okay, wait.
But that's what he's going to do.
I guess the question, put it up there.
What?
I would have said that was acidic.
If my PCO2, remember I told you to associate CO2 with acid. If my acid is too low, it's base. If my acid is too high, it's acidic. And this number, 32, is below the low number of normal, so it's basic for CO2 because it's not enough acid. Let's do another one. I'm like, all the bases are on this side?
That's how it comes to one.
Okay,
Cause
that's
now-
okay. We
Yeah,
got,
now
we got. I'm gonna keep giving you, I have 50.
Like an assignment, non-graded assignment, so that I
Like a
can,
deliverable for this particular LA?
yeah, so that I can practice, I
Yeah.
don't mind.
Okay, so let's do, we're gonna just keep doing these until you guys are like walking out of here going, dude.
You don't have to do it for the whole class.
Then I'll make a deal with you. You're more than welcome to go to lunch whenever you want to. I'm not taking roll anymore. 7.44, 30, 21. Let's give the people who are struggling just a second to catch up.
So I know the pH is normal.
Okay, can we just
Hold on.
Hold on. Talk quietly. It's like Jeopardy. Contestants, please keep your answers to yourself. Okay, so pH is 7.44. Where am I?
Like right on the edge of alkalosis. Right on the edge.
Normal.
My PCO2 is 30.
Base.
Yes.
My HCO3 is 21.
Something respiratory.
Now, I have one that's normal, so my pH is normal.
So it's full.
It's compensated.
So it's full, it's nine.
And it would be base. It'd be respiratory. Respiratory.
So it's all three, is that it?
Respiratory alkalosis.
So it's partial.
It'll be it's fully compensated because the pH is normal. The pH is
Let me see
normal.
if this helps you.
Oh, it's on the edge then. So you're gonna say that it's normal in parentheses, but it's more on the alkaline side. It's more on the alkaline side.
Who's the biggest problem?
The PCO2.
Respiratory alkalosis fully compensated.
Respiratory
Because the PCO2.
Which value
is 30.
is closest to?
Oh, okay, I see it.
You guys lied to me. No, never mind, you didn't. I flipped them and now in my head, I'm like, it's outside, it's outside.
Can I say something? Maybe put on that YouTube video with that Sarah arguing and maybe that will explain it, cause you know,
You can watch it on your time.
so I think
So how's the
Respiratory opposite metabolic. So respiratory opposite.
I'm confused, because I thought that was metabolic.
So how do you know respiratory is the next problem?
It might also help you if I put the values here. So PCO2, and I'm gonna keep our on this side away from
they make it more.
So
this is why alcohol, because it's towards, more so towards the base, than it is more so towards the acid.
Or not, okay. So let's do this one.
I know, so is that full?
Yeah, so
Because my pH is technically normal, it was just on the basic side of
That
me.
was a.
yeah.
And that tells me who wins.
So when it comes to, when you say the pH norm, That's basically, it's detecting if it's alkalosis or acidic, but it's also determining if it's full, partial,
Yes.
or not.
Yes, and I can tell you that that one is kind of hard. Your ones that you're gonna get in your test questions aren't that hard. They're pretty obvious.
Now, this is good. This is healthy.
Yeah.
Real healthy. Yeah.
Okay.
Because it's not giving you a visual for what each one. Because I began to train that food was compensated.
So everybody just hang tight. I know some of you are frustrated, some of you are pissed off at me right now. Some of you are trying to figure out what's going on. And I appreciate all of those emotions. I really do, and I embrace them fully. I'm just gonna, and I know some of you are confused, and it's okay. The more you do these, the more they will start to make sense. That last one that I gave you was a very difficult, that was a kind of a difficult one. But I like to push people just a little bit. I didn't mean to irritate anybody frustrated, but it was a little difficult. So even if it was kind of starting to make a little bit of sense, give yourself a pat on the back because that was a hard one. What we look for is when the pH is maybe just like right at the brink, like that last one was at 7.44. What helped me, again, I'm a visual person, was kind of moving it over to the, actually should have been more, well, no, that was right. So moving it closer to the side of what it was. Because that was technically really close to the basic side of pH, but it was still within normal limits. It was just way up high on the normal limits. So that's how you're going to be able to tell, is this a metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis, because then you look to see which other value is messed up, and if they're both messed up, which one is the farthest away from normal. That matches with where the pH is. So let's look at this one. My pH is 7.56, which is basic. My PCO2 is 20, which is basic. My bicarb is 20, which is acidic. Now then, I have nothing normal, so I cannot say it's fully compensated. But all three are abnormal, therefore I can probably say it's partially compensated. But is this metabolic or is this respiratory? Respiratory alkalosis, partially compensated. It's okay. It's okay. You didn't come out of the womb playing the piano.
I know, but
Okay, well, you might have.
That's where that road comes in at, that respiratory opposite,
Metabolic
metabolic
equal.
equal.
okay, so like I did that, but my thing is that when I did the pH, we did 7.56, right?
Yes.
That's alkalosis, right?
Right.
Yes.
So,
So should I put this as alkalosis?
okay. No,
Those two terms are used interchangeably.
okay, all right.
If something is
that's
alkalotic, it's basic.
So
If it's
then
alkaline, it's
base-
basic.
Okay, all right, and then, okay, I did it right there. All right, never mind.
Okay, let's go to another one.
So what was that answer now?
It was respiratory alkalosis partially compensated. Here's number 2.
Acid. Metabolic.
So start here. What's the pH? What's the PCO2? What's the bicarb?
Acidic.
Ain't the CO2, won't that be base?
37?
It's in the
Oh,
middle.
never mind. I'm
It's in the
sorry.
middle.
I truly apologize.
No. Trust me,
My
girl.
eyes were crossed.
Definitely I've done 14 times.
So it's base. Yeah. Thank you.
Metabolic acidosis.
So the pH is our determiner. So this is an acidic situation. my PCO2 is normal, so this is a metabolic problem. My patient is in metabolic acidosis, non-compensated, or uncompensated. I'm gonna put the word uncompensated.
Well, I'm so glad that y'all got it.
Just give yourself 5 minutes, Kizzy.
I'm gonna give this shit before I leave.
You don't give it today.
I'm not getting it.
No, we.
Give me some more questions.
Girl, let me hit the internet. Okay, here's number 3.
And we have to be back at 12:30?
No, one. We can leave at 12:30.
I'm like, hungry.
That's acid. Yeah. PCO2, but that's 30, that's bad. No, it's not. That's right on the middle. And then the 22, that's acid.
It's 34 and it's below 35. So that means I don't have enough acid, so it's basic. Remember? Okay, so my PCO2 is alkaline, my bicarb is 21.
I don't know which one I'll
So I have some kind of acidosis going on here. That's base, and then that's acid.
I don't know, because it's only 1:28.
This one was hard, I'm sorry. Okay, let's at least get this. Is it full compensated, part compensated, or uncompensated? It's partially compensated, so we know it's acidic, and we know it's partially compensated.
Yeah, that's why it's partially.
One is abnormal, he's abnormal.
But they're both 1 point away. Metabolic? She said metabolic. Why was it metabolic? I don't understand.
Professor, quick question. So, pH is acid. PCO2 is 34. So when I'm looking at that chart, because I'm gonna memorize that chart just like that, right?
Okay.
So when it's 34, that means it's more on the basic side, right? Okay, so it's on the basic side. Okay, and then the HCO3, the bicarb is 21, so that's more on the acidic side, right? So,
You want to know why it's metabolic?
Yes.
right,
Let me explain it.
okay.
It only takes one hydrogen ion, which is respiratory, usually. It only takes one of those, but it takes 20 of these
Okay,
to balance out.
okay.
So one off of bicarb isn't one of these little dudes, it's 120, it's one piece.
Okay,
So I need 20 of these dudes
right,
to make up for one of these.
okay.
So if I now only have one of these, I still have wiggle room with my hydrogen ion because it only takes one of those.
Right.
But now I'm gonna start tilting this way towards this, Jenny, come on. I know how to explain it, I'm just trying to make it, I know, I'm just trying to make it make sense.
Okay, so because it's 21, the bicarb is what is up.
Yeah, well, so is the PCO2. But it's a metabolic problem because of the number of bicarbs that it takes to equal an acid.
So it's like, because it takes more
Bicarb
than it
to like
does
trust
hydrogen,
a hydrogen.
that means it's a bicarb problem,
Yes,
which makes it metabolic.
yes.
Okay, so when it's a, okay, hold up. So
It takes more
bicarb,
bicarbonate to adjust things.
and when it's more bicarb, when it's a bicarb problem, it's automatically
A metabolic problem.
Okay, I
Always
got
put
you.
bicarb and metabolic and PCO2 with respiratory.
And metabolic. I got you. All right. Oh, Lord.
Your ones that you have on your test are not gonna be this
I
hard,
need
guys.
cigarettes today.
This is me pulling, just making numbers up. I mean, honestly, these were made up a long time ago, but
Push it a little. Let's do it.
I like to push everything. Okay. My pH is 7.5. Kizzy, where do you want me to put this?
Alkaline. Base.
My PCO2, Kizzy, is 32. Days.
Base.
My PCO2 is 32.
PCO2 is 32, so looking on this chart, I need to do it on base.
Okay. My bicarb is 24.
22 to 26, so that's gonna be, normal,
Perfectly normal.
okay? And then now it's, respiratory,
Alkalosis.
alkalosis, and then, I don't know, I'm still trying to figure this thing out.
Because
Okay, so
one of them is okay.
So what does that say, CO2 or HCO3?
Or either my carbon dioxide or my bicarb. One of them is okay, the other one's not okay. And that tells me
Okay.
the body hasn't
Gotcha.
quite figured anything out yet.
I got it. Cool beans.
So what did you say?
It's, respiratory,
Alkalosis,
alkalosis,
uncompensated.
uncompensated.
See, I told you just to give me a hot minute.
Yeah, it's okay.
You did it by number 5. And number 3 was a bear.
Now, but these, the ones that be like over and right at the tip, that be going
Okay, so do you want me to just give you 3 colors in the box to pick from, or do you want the 64 pack?
all of the colors.
Okay. So,
That one,
my pH is 7.46. Where's this going?
base.
My PCO2 is 36.
Base. Wait,
Thank you. My bicarb is 32.
32? No, it's alkaline, that's alkalosis, that's base.
So it's metabolic alkalosis.
Okay, so let's go back real quick to this normal.
Metabolic, alkalosis,
All right. Thirty-five to 45.
you got it, you can go ahead and go. I'm just gonna keep going till time.
Okay, I got you. 35 to 35 is normal.
You're the one who moved my numbers
Yeah.
around.
Now, I'm the one changing number names. Okay, cool. I got you.
Okay, so let's go to number 6. Okay, 7. So where does this go with pH? Base.
48.
PCO2 goes,
Acid.
bicarb goes,
Wait, hold on. No, it's high. 20, yeah, it's base, it's base. I'm tripping.
remember my bicarb is high, bicarb means base. D, bicarb base, bicarb base, bicarb base. So who's gonna vote for respiratory alkalosis?
So that's going to be.
I totally get you.
It's respiratory, alkalosis, and it's, partials?
I'm reading them, all three are normal.
Reading that wrong.
So I have, most of the votes seem like respiratory alkalosis partially compensated. How about metabolic?
Wait, metabolic. Oh, cause it's further.
This is another one. Hang on, everybody take a deep breath in for just a second so I can talk.
I need a cigarette.
Your classmate over here has brought up a good point. If this helps you. So, the pH is always the driver. So if my pH is alkaline, and my respiratory is supposed to be opposite, my metabolic will be equal. No, because these are both, I know that this is, okay, that was a bad example.
Yeah.
Okay. I gotta quit pulling these hard ones out.
Okay, hold on, 7.45.
I need my notes.
Who is the farthest away? It's actually metabolic, I'm just trying to figure out what. So let's skip this one.
Respiratory, hold on. They're not further away.
That was a bad one.
They're not really further away by much.
They were. Your test questions aren't gonna be like that.
Okay.
They're not gonna be that hard.
Okay.
I actually took these off of the New York Presbyterian Medical Student Entry Exam, so be proud of yourselves. Okay, let's talk about this person who's almost dead.
Yeah.
My pH is 7.25. My PCO2 is 60.
Acidic.
How's this feeling with you? Okay, my Bicarb is 27, which is like right there. By the way, this person is like circling the head. And what are we?
Acidic.
I got a question, Professor.
Yes.
I'm sorry.
No.
Okay. I'm sorry, guys.
Remember, CO2 is acid.
Right.
Lots of CO2, lots of acid. Which is why this human's pH is 7.25.
Oh, so that's right.
Respiratory acidosis partially compensated. Okay, let's go to this one.
She said I was too. So if it's too much acid, way over the chart.
Is acid, well, did you see how jacked up that PCO2 was? It was 60.
It was 60. So when it's 60, it's really jacked up. That makes it acidic. Okay.
My pH is what makes it acidic.
The pH was acidic. The PCO2
was really acidic. So I know it's a respiratory problem.
Okay, yeah, that's respiratory because that's the CO2. So it's respiratory.
Acidosis, partially
Acidosis.
compensated.
Partially compensated.
Yep.
Okay.
So now here's this one, number 8. My pH is what?
It's alkaline.
My PCO2 is 47.
Acid.
And my bicarb is 30.
Base.
Look at this, we're all over the place. So we know it's alkaline, or alkalosis. Dang, Jenny Long, what am I doing? I keep getting all these hard ones.
If it's 47, that means it's
Metabolic
alkalosis because the pH and the HCO3 are basic.
The HCO3 is off by more, so that makes it metabolic correct,
That is correct.
because it's off by 4
In general, yes.
in general. And the PCO2 is only off by 2,
Yes,
so it makes it metabolic.
yes. And remember, it takes more bicarb to fix things. So even though it's only 4, it's like a lot more than just 4. Okay. Keep trying to wipe my nose.
Did we already do that?
No. Oh, look at this. This is another human who's circled in the drain. My pH is, my PCO2 is,
49.
my bicarb is, uncompensated. Because I have one that's okay. I can't remember if your test question is going to ask you if it's compensated or not. I can't remember, but you still need to understand, because it tells you what the body's doing. If my pH is normal, but the other ones are jacked up, that tells me my body has compensated, is fully compensated, just my systems haven't caught up yet. If it's partially compensated, that tells you that the body is still trying to fight the good fight. So that tells me how deep I need to go into my nursing interventions, like how much do I need to correct before I back off and let the body finish it. When it's uncompensated, these are the patients that are in the ICU getting, hypertonic solutions and albumin and diuretics and all this other stuff. So you use the full, partial, and uncompensated to help you decide the plan of care or level of intervention for that patient. As far as whether or not it's going to be on your exam, I do not know because I haven't looked at those questions in a long time. But regardless, it's still good to know. And I can guarantee you, your blood gases are going to be, they're not going to be like 1 or 2 off like these have been. But if you're good at these and you're getting these right, you got the big ones. Those are easy peasy. Okay, so, did we decide that was respiratory acidosis uncompensated? Okay, good. Number 10.
pH 7.3.
I just do what y'all are telling me.
So that's
This one's normal, so we know it's not a respiratory problem. So we know it's a metabolic problem because my bicarb's the one that's jacked up. We know it's acidosis because my pH is 7.3. Now we have one thing that's normal, so that tells me that this is uncompensated.
So it's metabolic acidosis.
Uncompensated.
I'm getting it.
We'll just do a couple more. I don't want to kill you guys.
Okay, 7.35, that's.
I mean, again, I have 25, but we're only going to.
2 to 26.
That's what I'm going to stick in your learning activities. For fluid electrolytes, I'm trying to think of what's going to be the best thing to help you guys with fluid electrolytes. But for acid base, it'll just be like maybe 10 of these problems. I'm also going to see if I can pull my voiceover PowerPoint that you guys saw on 1128 and stick it. Do you want the acid base or the fluid electrolyte? Was there one in particular?
We'll take both of them.
And those, I don't remember how
200,
long
Alex.
they were, so stick those in there and give me the time too.
We'll take both of them.
7.41. PCO2 of 26. Bicarb of 17.
Acid.
That thing's like,
17 is 5, 26 is 9, so it would be respiratory.
Okay. Do you remember which one is going to catch up the quickest?
Respiratory.
is going to catch up the quickest. Bicarb is going to catch up the slowest. So my answer is respiratory alkalosis fully compensated. Because my respiratory is getting closer to being normal than my bicarb. Because they're both kind of far away. I mean, that one's like 10, and the bicarb is like 9. 3, 4, 5. My PCO2 is 9.